If you've never actually done a proper self-breast exam, or if you're not entirely sure what you're supposed to be feeling or looking for, this video could genuinely make a difference in your life. In the next few minutes, I'm going to walk you through 12 signs and symptoms of breast cancer that every single person with breasts should know because early detection remains one of the most powerful tools we have. Some of these symptoms are well known, but several of them are subtle, easy to dismiss, and often overlooked, even by people who are otherwise very health conscious. Stay with me through this entire video because understanding what's normal for your body and what isn't could genuinely save your life or the life of someone you love. Welcome back, everyone. Before we dive in, I want to say clearly that this video is meant for education and awareness, not as a substitute for professional medical advice. If anything in this video sounds familiar to what you're experiencing, please make an appointment with your doctor. Early evaluation is always better than waiting, and in the vast majority of cases, changes in the breast turn out to be caused by something other than cancer. But the only way to know for certain is to get it checked. With that said, let's talk about why self-awareness matters so much. Breast cancer is one of the most common cancers, and while mammograms remain a critical screening tool, especially for people over 40 or those with higher risk factors, becoming familiar with your own body through regular self-exams allows you to notice changes early, sometimes even before they would show up on a scheduled screening. Knowing your own normal, meaning how your breasts typically look and feel, is one of the most valuable things you can do for your long-term health. So let's go through these 12 signs one by one. The first and most well-known sign is a new lump or mass in the breast or underarm area. This is what most people think of immediately when they hear breast cancer, and for good reason, since it's one of the most common initial symptoms. However, it's important to understand that not all lumps are cancerous. Many breast lumps turn out to be benign, caused by things like cysts or fibroadenomas, which are non-cancerous growths. That said, a lump that feels hard, has irregular edges, feels firmly attached to the tissue underneath it, or doesn't go away after your menstrual cycle deserves prompt medical attention. When doing a self-exam, take your time, use the pads of your fingers, and move in a systematic pattern, either circular or in vertical strips, to make sure you cover the entire breast and armpit area. The second sign is swelling of part or all of the breast, even without a clearly defined lump you can feel. Sometimes breast cancer can cause the tissue to swell or thicken across a broader area, rather than forming a single distinct mass, which is part of why relying only on searching for a lump can occasionally miss early changes. If one breast appears noticeably larger, fuller, or more swollen than the other, without an obvious cause, this is worth having evaluated, particularly if the swelling persists beyond a normal menstrual cycle. The third sign is skin irritation or dimpling on the breast, sometimes described as looking similar to the texture of an orange peel. This happens when cancer affects the lymphatic vessels in the skin, causing fluid to build up and pull the skin inward at various points, creating a puckered or dimpled appearance. This particular sign is associated with a more aggressive form of the disease called inflammatory breast cancer, which makes it especially important not to dismiss unusual dimpling as simply related to weight changes or aging skin. Number 4 is breast or nipple pain that is persistent and doesn't follow the typical pattern of your menstrual cycle. It's worth noting that most breast pain, especially pain that comes and goes with your cycle, is not related to cancer at all and is instead linked to normal hormonal fluctuations. However, pain that is localized to one specific area that doesn't resolve after your period or that feels distinctly different from any discomfort you've experienced before is worth mentioning to your doctor, simply to rule out other causes. The fifth sign is nipple retraction, meaning the nipple turns inward or becomes flattened when it previously pointed outward normally. Some people naturally have inverted nipples their entire lives, and that alone is not a concern. What matters here is a change, meaning a nipple that used to project outward and has recently started turning inward. This kind of change can occur when a tumor beneath the nipple pulls on the surrounding tissue and ducts. Number 6 is redness, scaliness, or noticeable thickening of the skin on the nipple or breast. This can sometimes resemble a rash or mild irritation, which is exactly why it often gets mistaken for a skin condition like eczema or dermatitis. The key difference to watch for is persistence. A skin irritation that doesn't improve with typical treatments like moisturizer, or that keeps returning to the same specific spot on the breast or nipple, should be evaluated by a healthcare provider rather than treated indefinitely with over-the-counter remedies. The 7th sign is nipple discharge that isn't breast milk, particularly if it's bloody, clear, or occurs without squeezing the nipple. Discharge that happens spontaneously, meaning it appears on your clothing or you notice it without manipulating the breast at all, is more significant than discharge that only appears when the nipple is squeezed or stimulated. While many causes of nipple discharge are benign, including certain medications or minor infections, any unexplained discharge, especially if it's blood-tinged, warrants a conversation with your doctor. Number 8 is a noticeable change in the size or shape of one breast compared to the other. It's completely normal for breasts to have some degree of asymmetry naturally, and most people have one breast that's slightly larger than the other their entire lives. What matters is a recent, noticeable change, particularly if one breast has begun to look or feel different than it has historically, whether that's a change in contour, position, or overall shape. The 9th sign is a lump or swelling in the lymph nodes under the arm or around the collarbone, even if you don't notice any changes in the breast tissue itself. This is an important sign because breast cancer can sometimes spread to nearby lymph nodes before a lump becomes noticeable in the breast itself. During a self-exam, it's worth gently checking your underarm area and just above your collarbone for any new, firm lumps that don't go away after a couple of weeks. Number 10 is persistent itching of the breast or nipple that doesn't respond to typical remedies like moisturizing or antihistamines. Occasional itchiness is common and usually harmless, often related to dry skin or minor irritation from clothing. However, itching that is persistent, localized to one specific area, or accompanied by any of the skin changes we mentioned earlier, deserves closer attention, particularly because it can be an early symptom of inflammatory breast cancer or Paget's disease of the breast, a rarer form that affects the nipple specifically. The 11th sign is an increase in the visibility of veins on the surface of the breast, sometimes with the skin appearing to have a slightly bluish or more prominent vein pattern than before. This happens because tumors can sometimes stimulate the growth of new blood vessels to support their growth, a process called angiogenesis, which can occasionally make surface veins more prominent than they were previously. This is a less commonly discussed sign, but it's part of why becoming familiar with the normal appearance of your own breasts over time is so valuable. And the 12th and final sign is peeling, scaling, or crusting of the skin on the nipple, which is specifically associated with Paget's disease of the breast, a less common but important form of the condition. This can sometimes be mistaken for a mild skin irritation or dry skin, but unlike ordinary dryness, this type of skin change tends to be persistent, often affects only one nipple, and doesn't improve with regular moisturizing. Now that we've gone through all 12 signs, let's quickly talk about how to actually perform a proper self-breast exam, since knowing what to look for only helps if you're checking regularly and thoroughly. The best time to do a self-exam is a few days after your period ends, when breast tissue tends to be least swollen and tender, making changes easier to notice. Start by standing in front of a mirror with your arms at your sides, then raised above your head, looking for any visible changes in shape, size, dimpling, or skin texture. Next, lying down, use the pads of your 3 middle fingers to feel the breast tissue in a circular pattern, covering the entire breast from the collarbone down to the top of the abdomen and from the armpit across to the breastbone, using light, medium, and firm pressure at each spot to feel different depths of tissue. Finally, check the underarm area and gently squeeze the nipple to check for any discharge. Doing this consistently, ideally once a month, helps you build a clear sense of what's normal for your body, which makes it much easier to notice something that isn't. It's also worth emphasizing that self-exams are a valuable complement to, not a replacement for, clinical screenings like mammograms, which can detect changes in breast tissue well before they can be felt by hand. Current guidelines from major health organizations generally recommend regular mammograms starting around age 40, though this can vary based on individual risk factors, family history, and guidance from your own physician. If you have a family history of breast or ovarian cancer, it's especially important to have a conversation with your doctor about when to start screening and whether genetic counseling might be appropriate for you. To summarize everything we've covered, the 12 signs to watch for are a new lump or mass, swelling of part or all of the breast, skin dimpling or irritation, persistent breast or nipple pain, nipple retraction, redness or thickening of the skin, unusual nipple discharge, changes in breast size or shape, swollen lymph nodes under the arm or near the collarbone, persistent itching, increased vein visibility, and peeling or crusting of the nipple skin. None of these symptoms alone guarantee a cancer diagnosis, and in fact, most of the time, these kinds of changes turn out to have a much less serious explanation. But knowing your body well enough to notice when something is different and having the confidence to get it checked promptly rather than waiting and hoping it resolves on its own is one of the most empowering things you can do for your health. If this video gave you helpful, clear information, please take a moment to like this video because it genuinely helps this important message reach more people who need to see it. Subscribe to this channel if you haven't already, because we share reliable, easy-to-understand health education just like this every week. If you found this helpful, please consider sharing it with a friend, a sister, a mother, or anyone in your life who might benefit from this information, because awareness truly does save lives. And if you have any personal experiences or tips about performing self-exams that have helped you stay on top of your health, feel free to share them in the comments below. I'd love to hear from you. Take care of yourself, take care of each other, and I'll see you in the next video.